Good afternoon all. Today next topic is premature rupture of membrane, otherwise PROM. PROM, define PROM. This is an essay question can ask. If you ask define PROM, the causes, management, likewise can be asked. That is come to the PROM, that is come to introduction. Uterine sac. It is, you see, uterus is inside a fluid, that is the fluid. Uterine sac, yolk sac you can see, placenta, amniotic fluid, embryo, that is uterus, then chorion. Chorion you see, amnio. Then this uterine sac, there are mainly two membranes of uterine sac, that is the chorion and amnion. Then amniotic sac, that is the amniotic fluid. Then you see, that is amniotic sac, fully the fluid, inside that the fetus is lying. So functions of amniotic sac, that is amniotic fluid. The amniotic sac is filling with amniotic fluid. This fluid will provide protection as fetus, protection to fetus, and function as cushion of fetus. That is when we are pressing, that also it will be float like that way. In the baby won't, the uterus, fetus won't cause any disturbance or any injury. So it will be protect. That is the function of the amniotic sac. This fluid allows the fetus to move freely in uterine cavity. In case that is in a balloon, we are filling the water, and there we are placing an object. That if object will be freely move inside that balloon. Then that object, if we are pushing also, that object won't got any disturbance or any injury. That's the same for here also. Then definition, PROM define, we can define as rupture of membrane, premature rupture of membrane, rupture of membrane or breaking of amniotic sac more than 1 hour before the onset of labor. That is the premature rupture of membrane before, that is the time of the labor. On the time of labor before 1 hour, that is the membrane, that is the full cervical dilatation is not occurs, and the engagement not occurs. Then before that itself, the membrane, that membrane has fluid breaking occurs or rupture occurs, then we can say it as a premature rupture of membrane. Classification according to the fetal age: premature rupture of membrane, preterm rupture of membrane, that is the PROM, prolonged preterm rupture of membrane, previable preterm rupture of membrane, preterm premature rupture of membrane. First we can see preterm premature rupture of membrane. In this type, premature rupture of membrane, that rupture before the 37 week of gestational age. That is the before the 37 weeks of gestational age, we can say that preterm premature rupture of membrane. Then prolonged premature rupture of membrane. In this type of rupture, 24 hours has passed between the membrane rupture and the onset of labor. The time of labor, for example, actually the full dilatation, cervix is fully dilated and engagement, everything has occurred. And also that probably according to the scenario, we can say that is the normal rupture can be occurs at an time, normal delivery is occurs at the time of 2 o'clock. But in that time also membrane is not ruptured. That is called as the prolonged, that the time has extended out. After rupturing only the baby can come out of the uterus. The membrane ruptures only, the baby will be come out of the uterus. If in that condition also the membrane is not ruptured, we can say it as the prolonged premature rupture of membrane. Then previable preterm premature rupture of membrane. This type of rupture occurs before 24 weeks of gestational age of fetus. That is the fetus is not able to viable. If the fetus is come outside the uterus, the fetus is not able to leave. Totally death will occur. That is the pre-viable. The fetus is not able to viable. It is also known as mid-trimester pre-viable premature rupture of membrane. Okay, clear about that one. Then causes: weakening of the membranes, extreme force of the contraction of uterus, That is, if we are while we are during the onset of labor, that is the first stage, observation stage. We are seeing, assessing the mother, that is the uterus, cervix is dilated, engagement has occurred. Likewise, we are assessing, and finally we can say that we can give oxytocin drip for give more contraction of the uterus. If the oxytocin drip also unit is also increased, there will be extreme force of contraction will occurs. Then fetal movement, that is fetus is movement is very high. Sometimes there will be chance of rupture occurs. Then risk factors: infection, UTI, urinary tract infection, STDs, sexually transmitted diseases, bacterial vaginosis, amniotic sac infection, smoking during pregnancy, previous history of PROM, previous history of preterm labor. Then polyhydramnios, that is the increased fluid greater than 2000 ml. Normal is amniotic fluid normal 800 ml. Note out that normal fluid of amniotic fluid normal is less than 500. We can say as oligohydramnios. Then multiple gestation or multiple pregnancy, twin pregnancy. Then hemorrhage or bleeding any time during pregnancy. That is early hemorrhage will be occurs. Early hemorrhage, that is the hydatid for molar abortion, that all are the early hemorrhages. Later hemorrhage is the PPH, that is not PPH, antepartum hemorrhage that comes. Then invasive procedures are amniocentesis, that is we are puncturing the amniotic sac and we are aspirating the fluid for detect any congenital abnormality. In that case, easy. Then cervical insufficiency, footing breach, footing breach alla, footing, FOOTLING, footing breach, application of vaginal cream. Then signs and symptoms: painless leakage of fluid from vagina. Due to loss of fluid, fetal can easily feel through belly, decreased uterine size, meconium present in fluid, abdominal pain, fetal heart sound altered, gush of membrane, absence of steady labor contraction. Then diagnostic evaluations: history collection of previous labor, maternal history, maternal illness, fetal movement assessment, fetal position, blood analysis, sterile speculum examination to assess inside the vagina. Then management of classification, how the management classification in term fearless greater than 37 weeks. We have seen the classification, okay, according to that term greater than 37 weeks. Then management, induction of labor, antibiotics if needed to prevent, that is the Guillain-Barré syndrome transmission. Then late preterm 34 to 36 weeks, same as for the term. Then preterm 34 to 33, watchful waiting, expectant management, tocolytics to prevent beginning of labor, magnesium sulfate infusion 24 to 48 hours to allow maximum efficacy, or steroids for fetal lungs, tocolytic, and also confer benefit to fetal brain and gut before delivery. One-time dose of corticosteroids to separate administrations 12 to 24 hours apart before 34 weeks. Antibiotics if needed to prevent GBS transmission. Then pre-viable to less than 24 weeks. Discussion is watchful waiting or induction of labor. No latency antibiotic, corticosteroids, tocolytics or magnesium sulfate. Then nursing management, hospitalization of women evaluated for labor, fetal distress, infection, complete bed rest, continuous observe the fetal movement, continuous observe the fetal heart sound, continuous assess the vital signs of the mother. Okay, thank you. And also one more information for you. You should see the obstetrics test, the obstetric test for detailed premature rupture of management. Okay, that is the management detailed it has given. Then just for short only I have given here. For detail you may add that one. Okay, thank you.